We are covering skeletal muscles of the lower arm, specifically looking at a right arm, and we'll look at our flexor muscles along with our extensor muscles. And then I'll show you a key. So our goal is to go through these muscles as I cover them, see if you can identify them just the same. It is a picture, and it may not be the same pictures, models, or charts that you have in your labs, but it still helps to practice the names and the general locations of the muscles. So we'll do identification, and then I'll add the origin, insertion, and action later to summarize the attachment points. Origin, insertion. Remember, insertion is our point of attachment where you have more movement. Origin is the point of attachment where you have less movement. And then we'll talk about the basic actions. I like to incorporate these in different segments. So I put them together as the flexor side and the extensor side. So we'll cover them. And also, I add a study guide to this. If you're interested in that, you can take a look at the study guide for muscular system. But we'll start on the posterior side. And what we're seeing coming down is from triceps brachii towards the elbow. And right at the elbow, we have Anconeus. And then I flip around and I look at this as a flexor muscle, and this is flexor carpi ulnaris, and because it's on the pinky side, flexor carpi ulnaris. And then I start all my extensors. So extensor carpi ulnaris. So my two carpi ulnaris muscles are together. I have flexor carpi ulnaris and extensor carpi ulnaris. And then I have the small little muscle, extensor digiti minimi, because it's going down to just the pinky side. So on my fifth metacarpal to my phalange. And then I highlight number 5, where you have all of these tendons going down to my digits here. And as I follow the tendons, sometimes it helps you to understand the name of the muscle because I'm extending the digits. So extensor digitorum. So I did Anconeus, I have flexor carpi ulnaris, extensor carpi ulnaris, extensor digiti minimi, and then all of this is extensor digitorum. When I come on the flexor side, decreasing in angle, I come down from biceps brachii. Remember, biceps has 2 heads. It has a long head and a short head. The lateral head is the long head. So I remember the letter L for L. The short head's on the medial side. But they both come down and insert at the radial tuberosity. But then I focus on underneath it, I would have Brachialis along the arm. So splitting in between triceps brachii and biceps brachii is Brachialis. So you can see a little bit of it here underneath biceps brachii, or deep to it. And then as I run into it, it goes from the brachial side to the radial side. So all of number 7 is Brachioradialis. Brachioradialis. And then we tend to learn the 3 superficial flexor muscles. So I have first number 8 here is flexor carpi radialis, because it's on the radial side. Going down to the middle of the palm here, number 9 is Palmaris longus, to the middle of the palm. And then number 10 is flexor carpi ulnaris, because it's on the pinky side. So we have biceps brachii, brachioradialis, and then these 3 here are my 3 primary superficial flexors. I have flexor carpi radialis, palmaris longus, and then I have flexor carpi ulnaris. And then we add one muscle of the hand here, abductor pollicis brevis, and this is referring to the pollicis for the thumb to help me abduct the thumb. So let's take a look at the key and see how you did. So here's our key. We did Anconeus, number 1, flexor carpi ulnaris, and then my extensors, extensor carpi ulnaris, extensor digiti minimi, you can tell I love saying that one, extensor digitorum. As we flip over to the flexor side, biceps brachii, underneath it, I don't have it labeled, brachialis, turns into brachioradialis, and it doesn't literally turn into it, I just like teaching brachialis, runs into brachioradialis. My 3 flexors, flexor carpi radialis, I have palmaris longus, and then flexor carpi ulnaris, those 3 superficial flexor muscles. And then I just added this one. A lot of muscles will show abductor pollicis brevis. Now let's look at the actual OIAs for this. So starting with Anconeus. So it's hard to see here, but it's attaching to my lateral epicondyle and also going over to the olecranon or the ulnar shaft when I insert. But its goal is to help elbow extension. So it's extending the elbow, so it's doing that with the triceps brachii. As I come down to flexor carpi ulnaris versus extensor carpi ulnaris, I have the medial epicondyle versus the lateral epicondyle. Now, when I look at ulnaris, it's coming down to some of my carpals and my metacarpals. So it'll go to the pisiform hamate. Remember, so long to pinky, here comes the thumb is a common mnemonic to learn your carpals. And then over to my fifth metacarpal towards the ulnar side, the pinky side. And my goal is to flex the wrist or add it together. Extensor, though, now we're extending the wrist at the fifth metacarpal. So I try to put these and group them together, because then you'll see then we add then the fifth phalange. So as I look at this extensor digiti minimi, that small little muscle that's going from, again, the lateral epicondyle down to my fifth finger, but on the proximal side, so I can extend my finger. So extend the pinky. And then I get into digitorum. Remember when we said digitorum, it's got all these tendons to help extend the wrist and the phalange. So extend, often so when you're pulling on the gas on a motorcycle, vroom, vroom, that's extensor digitorum. We repeat lateral epicondyle. So then I tried to keep track of all my lateral epicondyles. So my Anconeus, my extensor carpi ulnaris, and my extensor digitorum. And then lastly, biceps brachii. Remember, two heads, so it's going from the coracoid process, and then the long head wraps up over the top of the supraglenoid tubercle. It all inserts at the radial tuberosities, and we see a lot of injuries there, but it goes back to our primary purpose or action is to flex the elbow and allow for that supination. Remember, when I give you a cup of soup, I'm giving you that rotation, which is the opposite of pronate or teres. When we get into the other ones, Brachioradialis from the arm to the radius side. So we repeat again with lateral epicondyle. It's just different pieces of the lateral epicondyle. Going down to the styloid process. Remember the radius when we learned that little landmark or bony landmark? That radial styloid process kind of looks like the thumb. And its goal again is to flex the elbow. And we'll see this repeat. Flexor carpi radialis now on the medial epicondyle. So you can start to keep track of our epicondyles on the lateral side and the medial side to again flex the wrist and then abduct it. So continuing with flexion. So I put these together for a reason, because you can start to collectively organize them instead of trying to learn them one by one. That palmaris longus is going down at the palm. Remember, an aponeurosis is a flattened tendinous sheet, and that retinaculum is what wraps around the wrist to give you that connective tissue, essentially like a rubber band around all the tendons. When I go down to flexor carpi ulnaris, back to the medial epicondyle, so it's repeating, but we're going now to pisiform hamate fifth metacarpal. So you can see this repeats when we look at the extensors. And then we're extending on one side, but we're flexing on some. Ignore that last part. And so we're flexing the wrist again and adducting it together. And then adductor pollicis brevis, going back to this is referring to the thumb. So our goal is to abduct the thumb because we're going to insert on the proximal phalange. So adductor pollicis brevis. So as you organize your OIAs, try to put them together in similarity based on their actions, because when they have similar actions, some of the O and the I's or insertions are also the same. I've been teaching for 20 minutes. I've been teaching anatomy for 24 years. I hope this is simple for you. Subscribe if it continues to help. I'll continue with other systems.